To attenuate the spread of COVID-19, most governments around the world have mandated quarantine. Our educational institutions are never the same. This is the new normal, and the Jose Maria College believes that learning never stops. With the advent of technology, we are now opening a more innovative virtual learning experience. In response to this crisis, the Jose Maria College brings you the two instructional delivery options.
No virus can stop our assured, consistent, and quality education. The Jose Maria College, under the leadership of its founding president, Pastor Apollo C. Quiboloy, holds true to its mission to provide quality education amidst the ongoing crisis on COVID-19. To ensure that all learners will get the best learning experience, the school has crafted two learning delivery options. Option 1. Online delivery. Students who have a stable connection to the internet shall undergo full online classes via platforms such as the Google ecosystem, Zoom, and an online learning management system. Online classes shall be held by our competent teachers on a daily basis. All interaction shall be via online, as there shall be no face-to-face interaction in order to keep you safe during these trying times. Option 2. Self-paced learning. For students who see it as a challenge to secure a stable connection to the internet, the school shall be providing modules and other instructional course packages. Students will work on these learning materials and from time to time may need to send their academic work online or discuss their progress with their teachers via email, chat, or video call on a scheduled time. They may attend online classes when their internet connection is stable enough for them to do so. Education goes on for the Jose Maria College. Your future, our mission. Enroll now. For more details, visit us at www.jmc.edu.ph.
Good day, everyone! Welcome to another episode of JMC EduTrends, a discussion that informs, inspires, and transcends. To all our first-time viewers, this program streams live on www.facebook/Jose Maria College and on YouTube at JMC EduTrends. Don't forget to type in your comments and questions, send your emojis, click the subscribe button, and ring the notification bell so you would be notified of future discussions on JMC EduTrends. Without much delay, ladies and gentlemen, help me welcome the program host of today's discussion.
Good evening, netizens and JMarians. Welcome to another episode of JMC's EduTrends. I am your host, Ms. Mary Chelsea Delmar, and I am one of the faculty of the College of Medical Technology. Together with me is our technical director, Ma'am Mirna Ambrosio, and also the dean of the sponsoring program for this episode, Ma'am Bea Lau. Thank you, ma'am, for being with us this evening. And of course, our guest speakers. We are expecting speakers from the Southern Philippines Medical Center and Davao Doctors Hospital. Both are the chief medical technologists, Ma'am Zenaida Banzon and Sir Glenn Castro. Daghang salamat po for gracing our show today. And And to formally start our program, let me call in the Dean of the College of Medical Technology, Ma'am Maria Bayalao, for her opening remarks.
Good evening, Ma'am Chelsea, and to our speakers, and of course to our technical director. Thank you for um, gracing us the time this time. So good evening once again, and to our viewers, no, good evening for tonight's session of EduTrends. In tonight's discussion, the College of Health Science, together with the faculty, hopes to give awareness to the community about the services our hospitals, especially the clinical laboratory, is continuously providing amidst the pandemic. In tonight's session, we are thankful for the two of the most respectable heads of the laboratories here in Davao City is here with us and to enlighten us about their services and current practices in lieu of the new normal. We are hoping that this will be helpful in sharing the awareness to the public that despite the limitations of movement due to the COVID-19 pandemic, health is still a priority and it will always be important and laboratory services are available. Without much further ado, welcome to our episode of EduTrends hosted by the Medical Technology program of College of Health Science. Good evening.
Thank you so much, my dear Dean Bea, for that wonderful opening remarks. All right. So it is undeniable that COVID 19 has changed a lot of our norms. One of these is the laboratory services in our hospitals. Before the pandemic, we are just able to walk in and out of the laboratory to have our sugar and our cholesterol monitored. However, as of this time, we are even doubtful to walk inside the hospital premises and might ask ourselves if it is okay to do our routine lab testing. To enlighten us on these topics and questions, our chief medical technologist from Southern Philippines Medical Center and Davao Doctors Hospital will inform us about their laboratory services amidst the pandemic. So let me give the floor to our speaker number one. He graduated Bachelor in Medical Laboratory Science at San Pedro College. He has worked as a rotating medical technologist at Davao Doctors Hospital, Department of Pathology and Laboratory from May 2014 up to September of 2015. He became the section head of the histopathology and cytology department of the said hospital from September 2015 up to January of 2019. And now he is currently the chief medical technologist at Davao Doctors Hospital, Department of Pathology and Laboratory. He also has experience as a clinical instructor at San Pedro Hospital and has published his book entitled The Incidence of Trichomonas vaginalis among prostituted women in Davao City that can be retrieved from the Department of Bachelor in Medical Laboratory Science at San Pedro College. Ladies and gentlemen, help me welcome our CMT from DDH, Mr. John Glenn Castro. Hello, sir. Good evening.
Hello, everybody. Good evening. Thank you for inviting me to be one of your guest speakers for tonight. It is my genuine pleasure. Thank you.
Thank you. You're very much welcome, sir. So, sir, we will give you now the floor to present the laboratory services of Davao Doctors Hospital.
Okay, thank you. Let me just share my screen real quick. Okay. So, can you see my screen now? Okay, so good evening. So, as I was informed, our topic for tonight will be rotating or revolving around the topic of laboratory service amidst this pandemic. So to formally begin my segment of tonight's talk, let me just ask each and every one of you, where were you on the 12th of March 2020? So let me just give you a recap. So March 12, 2020 was when President Duterte placed the entire of Luzon on lockdown, and then Mayor Inday Sara Duterte subsequently followed by placing Davao on ECQ on April 4 to May 15, 2020. So to answer the question, where was I on the 12th of March 2020? As I vividly recall, we were on the Royal Mandaya Hotel. I was actually with Ma'am Bea and Ma'am Jigs, the speaker after me. So we were with the Regional Lab Network, and we were having this workshop on the laboratory action plan. So it was a 3-day workshop. We were on the second day. So because of this proclamation from the president that he places Luzon on lockdown, the third day was postponed and was scheduled on a later date. So, yun. So, the third day was actually held a few months after. So, I think it was the entire program or the entire training was finished 8 months after. So, moving on. The next part of my report is a little bit of a Kahoot or a game. So I don't think I can hear you because I don't think the system or the program allows speakers or the audience to speak. But you can answer by typing in your answers a chat box or answer privately. So the game is guess the logo. So for the first logo, so this is very famous. So please type in your answers. And after a few seconds, I will reveal the answer. So again, this one is Food Panda. So I know nobody from the audience got it wrong. So the second logo will be this one. So what is this? Or what company has this logo? Okay, so this one is actually Grab Food. Okay, so for the third company, so ano pong company has this logo? Okay, so the answer for this is Lazada. The next, so ito, ano to? Okay, so this one is actually GCash. The next, so again, I'm pretty sure most of you have got it correctly so far. So the answer for this is Shopee. So for the last logo, so ito, anong logo ito? Okay, so this is actually Med Lifestyle. So what is the Med Lifestyle? So Med Lifestyle is actually the program or the service offered by Davao Doctors. So as you can see, when the lockdown or when the ECQ was instituted, most of us didn't have the liberty to go around because most of the services, most of the shops were closed. So it became a hassle to go around kasi again the strict lockdown measures were in place. So meron pa yung mga QR codes, meron at the time at the peak of the ECQ from April to May, we had this FM pass and so on and so forth. So going out became a hassle. And then in addition to that, high-risk individuals weren't allowed to go out. So that is, because of that, as a result, a lot of the services that became patok at the time were actually online. So yun yung mga answers kanina, such as Shopee, Lazada, GrabFood, Foodpanda, and GCash. So all of those businesses were able to reach out to their clients by being accessible at home. So they can do transactions at the safety and comfort of their homes using their smartphones or their computers. So going back, hindi magpapatalo dito tayo sa Med Lifestyle, hindi magpapatalo naman si Davao Doctors Hospital. So Davao Doctors Hospital rather made its own online service. So that is the Med Lifestyle. So what is the Med Lifestyle? So the Med Lifestyle has these following features. So number one, you can do online consultations. Diagnostic procedures can be requested through the online platform. And thirdly, online results can be viewed and actually downloaded and printed in PDF formats. So online consultations. So if you have doctors in Davao Doctors Hospital, you can actually set an appointment with them through the DDH Med Lifestyle. So they will see you, they will conduct an online consultation with you online. So they can do it via Google Meet, they can do it via Zoom, they can do it via MS Streams, they can even do it via Facebook Messenger. So basically, they can check you up. Of course, they can't do the routine auscultation, manual taking of blood pressure, but other than that, they can check you based on the signs and symptoms that you were actually exhibiting. And based on the signs and symptoms that you currently display, they can request diagnostic procedures for you. So you as the user of the program or the application, you can request or you can call the Davao Doctors Hospital hotline to have yourself scheduled for a blood extraction via the home care. This home care is again still linked with the DDH Med Lifestyle. So what is this home care? Home care is basically a home service. So if you have blood extractions or you have laboratory works that needed to be done for you, you can call the laboratory to have one of our medtechs go to your place, draw blood, and then bring it back to the hospital for testing. So in addition to that, other services can also be requested online via home care. So these include ABG, ECG, and so on and so forth. However, we are limited to those services because we cannot bring, for example, the X-ray machine. You cannot bring the X-ray machine to your home to have an X-ray conducted. Number two, if you have an ultrasound or a CT scan, we can't bring that whole machine to your house to have you tested. So it's basically limited muna, basically to the ECG, the laboratory, and the ABG for the respiratory therapists. And lastly, once you've had your blood sample or samples collected, you can actually check the status of your results. So much like pag nag-order kayo sa Lazada, you can track where your package is. With the DDH Med Lifestyle, you can track the status of your sample. So you can track if the sample has been received already by the laboratory. You can track if the sample or your sample it's already ongoing processing, and you can also track it if it's already been released. That's because our laboratory information system is synced with the DDH Med Lifestyle. So meaning to say, you can see the status of your results. However, you cannot see your final result until it has been released by our medical technologists. And the beauty of this is all our results are in PDF format and are downloadable and printable. So of course, this has limitations. You cannot view your results for HIV, drug test, biopsy, because these results are very sensitive in nature. So we can trace we can trace those information falling into the wrong hands. So dun tayo sa mga routine lang ng mga laboratories. So another beauty of this is your results are stored in the system, or your results for the past 300 days are stored in the system. So meaning to say, you can do delta checking, or you can compare your previous result with your current result. If there is an improvement in the values, or it's remaining the same, or worse, it's just getting worse. The result or your values are getting worse. Okay, so once your results are available, you can now go back to your doctor online to do another online consultation. So this is the Med Lifestyle. So just a disclaimer, currently the DDH Med Lifestyle is ongoing upgrades. So you cannot access it at the moment because the DDH Med Lifestyle was actually a very big success that we did not expect that large amount of patients to actually make use of the program. So now that it has been established that this program is a success, we have done upgrades so that we can cater to more patients. Okay, so moving on to the second service na ibibida ng Davao Doctors Hospital is the first drive-through laboratory in Davao. So we termed this, or we coined this, the Lab and Go. So the Lab and Go is basically para ka lang nag-order ng drive-through sa Jollibee or sa McDonald's. So you go in a driveway. So of course the first station will really be the cashier, because that's where your payments are going to be done. And then a few meters ahead, extraction cubicles are actually situated, wherein, or actually extraction stations are situated or are placed to have your blood samples collected. So as you can see dyan sa picture, there's no need for the patient. If the driver is the patient, or kahit the passenger is the patient, there's no need for the patient to actually go down, because you just basically put your arm out and the medical technologist will take care of the rest. So again, this one has been a large success. However, I'm not allowed to disclose the figures as to the census and revenue, kung magkano na-generate and kung ilan ang na-cater. But just to give you an idea, let's just say that during the time wherein there was an intense drop in admissions and patients who actually availed the service, the Lab and Go actually tied us over to actually for us to be able to maintain our operations. So yun, it generated quite a substantial amount. So because of the success of the Lab and Go, or the drive-through ni Davao Doctors Hospital, we have decided, or the management has decided to expand the services the drive-through offers. So what are the additions to the Lab and Go? So the following are the services that you can also avail. However, these services, you need to come down, or you need to go down of your vehicle to have your x-rays done and to have your ECGs done. So merong bed doon sa loob ng mobile na van kasi kailangan nyo humiga for the ECG. So that one. So what kinds of x-ray can be done at the Lab and Go? So the following. So you can do skull series, you can do shoulder x-rays, chest, elbows, hand, wrist, pelvis, knee, and foot. So basically, I think it's the complete package, basically. So just to add, if you're going to avail the Lab and Go on a Sunday, you can actually avail of a 10% discount sa Lab and Go services. So what actually Davao Doctors did is, because during the pandemic, patients were actually afraid to come in the hospital complex. So what the management did in response was that it made the services available, or it brought the services outside of the hospital for it to be available sa mga patients without having to come inside the hospital. Kasi again, we need to be able to address yung anxiety ng patients, the fear of the patients contracting the virus. Of course, we're implementing strict health measures to ensure safety inside the hospital. But again, to allay those fears, we had to modify our services in order for it to be available to the general public without actually having to come into the hospital. Okay, so thank you for the time listening to my presentation. So if you have any questions, I guess there is a forum later on. So again, thank you and keep safe.
Thank you. Thank you so much, Sir Glenn. So we will ask you later on. I will have to hold on for wait a minute. Our second speaker, our dear netizens, is actually a dedicated laboratorian. She is also a leader, an academician, and a mentor. She also has been engaged in various and professional and civic organizations. And she is currently a council member of the Regional Laboratory Network in Region 11. She is the PAMET Davao chapter's vice president, a consultant, and a trainer for microscopy training and parasitology group of experts. She is also a member of the CHED, RQAT, and many more. And of course, again, she is the Chief Medical Technologist of Southern Philippines Medical Center. She is none other than Miss or Ma'am Zenaida M. Banzon. However, my dear netizens, she is currently experiencing technical difficulties as of the moment due to intermittent internet connection. So, still, we are very honored and proud that Ma'am Jigs Banzon or Ma'am Zenaida Banzon has graced our event for this evening. We thank you so much, Ma'am Jigs. So now let's proceed to the question and answer portion, or questions that our viewers and us ourselves have for our remaining speaker, Sir Glenn Castro. Hello, Sir Glenn. Welcome back to this. Ayan po. Hi, sir.
Hi, Chelsea. Good evening.
All right. Good evening, sir. So, sir, thank you po so much for sharing the services of Davao Doctors Hospital amidst pandemic. So, I believe it's a very convenient service for the public to know that your hospital has a lab and go, and actually a med lifestyle wherein they can log in online and then they can have their health checks.
Yes,
Okay, so
actually,
sir,
na-market na rin, na-market na rin yung mga bagong services indirectly. So, thank you.
no problem, Sir Glenn. So, sir, we have a question po. The first po is that how are you right now that we are already 1 year since the declaration of the COVID-19 pandemic? How did this affect our clinical laboratories and, of course, our fellow medical technologists po in your hospital, sir?
Actually, the pandemic really affected us in a lot of ways negatively. So, but in the same way, it also has affected us positively. So let me first discuss ano yung mga naging challenges, especially last year during the start of the pandemic. So first and foremost, when the pandemic struck, we were actually caught off guard. So,
yes, I believe so. Yes, I think everyone naman, sir, no.
Yes, to be frank, we were actually caught off guard. So we didn't know how to actually don on a PPE. We didn't know how to remove PPEs, and in addition to that, our specimen collections were limited to venipunctures or blood extractions. But because of the COVID crisis, we've had to learn how to collect samples via nasopharyngeal swabbing and oropharyngeal swabbing.
Yes.
So in addition to that, some of the pressing issues that we've had to face is number one, the morale of the staff. Because again, it's a virus, it's a pandemic. So it's natural for our staff to feel afraid, not just for themselves, but also for their families.
For their families.
So mga inuuwi nila sa bahay. So also we've had to address that. So number two issue is perhaps since the government needed a lot of health workers, a lot of positions actually opened up. So it is a very well-known fact naman that the government offers better salary and compensation compared to the private institutions. So,
yes.
yes, so because of that because of those job openings, a lot of our staff actually transferred to government health institutions. So now that 1 year into the pandemic, so I'm happy to say that at least we were able to address yung morale of the people of the staff. So again now they're able to do the procedures, yung swabbing, they're able to face the patients more confidently because they have been vaccinated, because of all the PPEs, of all the SOPs and procedures that we've put in place for them to ensure their safety. So yun.
So, sir, speaking of the low morale of your coworkers, and I think every one of you also in the hospital. Um, did your hospital or did the lab or the department had like a support group or at least a professional for mental health crisis who helped you cope with the anxieties, maybe depression of the staff?
Yes,
Was there any
actually,
support group?
yes. Actually, the HR or the HR of Davao Doctors Hospital was able to come up with a program. So they named it I Am Here. So itong I Am Here are actually composed of first aid rescuers, so mental with regards to the mental health or mental support needed by the staff, and there are actually psychiatrists and psychologists on board because again because of the pandemic, it also had an effect sa psyche ng mga tao. So I was able to read in one article that because of the pandemic, because of the lockdowns, there has been an increase in incidents in depression and again other mental health problems. So because of this, again, Davao Doctors came up with a program I am here. Well, and I'm happy to say naman that the staff are actually responding positively. So they're actually seeking help if they need it. They acknowledge that they need mental support. So they're actually availing of this service from the hospital.
Yeah, so that is a great news that your hospital is also looking out for your employees. Right, sir, next question po. Hello, Ma'am Jigs. Ma'am Jigs is actually watching. She said she can't access po daw. So, down po ang net ni Ma'am Jigs. I can only listen and watch in FB. So, hi, Ma'am Jigs. Okay. So, sir, the next question po, sir. What are the laboratory protocols that an adult needs to follow when they want to have their tests done that may or may not come from a physician? What documents, what should they do first before coming in the hospital or in the lab?
Actually, there is a health declaration form. So if you've been to the hospital recently, so there are actually tablets that's situated along the around the entrance area. So there, patients have to input their history, their travel history, if they're
Mm-hmm.
experiencing any symptoms, if they're experiencing or if they've had any contact with a known positive individual, the usual questions. And if
Mm-hmm.
the system detects that the patient is considered to be a high risk individual, then they are endorsed sa ambulance bay natin. So the ambulance bay is actually where symptomatic patients are catered. That's the reason for that is because we don't want the symptomatic patients mixed
To
with the
interact.
symptomatic patients. Yes,
Yes.
because
Yes.
we're trying to minimize the transmission of the virus. So that's one. And another one is perhaps yung QR code. So parang mall. So you're not allowed access to the hospital if you don't have the QR
The
code.
QR code. So, sir,
Yes.
that
So
is true for our patients who doesn't have a physician's order.
for now, we're not allowing patients to have their blood tests done without a doctor's request because we have to have them see their doctor first because the doctors actually are already oriented to mark patients that are actually possibly COVID carriers or possible COVID patients, probable COVID patients, so that we can endorse them to our ambulance bay to have their lab tests done. So as of the moment, hindi siya gaya dati na if you wake up one day and just realize that you want to have your FBS or lipid
Yeah.
profile.
Yes. Uh-huh.
So hindi siya pwede at the moment. So you really have to have your doctor's request. Anyway, we're quite flexible with this. So we're not sticking with the traditional na doctor's request na paper nakasulat
Paper.
doon. Yes.
Mhm.
Um, Text message coming from our doctor will do. A picture sa messenger. We honor them. And then ano pa ba? Yung sa Med Lifestyle, we also accept those requests coming from the Med Lifestyle.
Same is true in the lab and go, Sir Glenn.
Yes, the same is true with the Lab and Go.
So, how about the pediatrics, sir? For like vaccinations, baby well checkups, is it the same also?
Yes, however, they have to enter through the emergency room because in the emergency room they are being triaged. So again, sa emergency room, um, the symptomatic patients are separated from the asymptomatic patients. However, for vaccinations sa mga pediatric patients, the attending
Mm-hmm.
physician or the consultant can actually do that sa clinic na lang mismo. So no need for them to
Ah, yeah.
actually go sa ER.
But for pediatrics with lab test po, sir, paano po?
Yes, if the patient or if the child is asymptomatic, then they can go to the laboratory. If the patient is located sa ER, so the medtech will go to the ER because again sa ER naka-separate si symptomatic and si asymptomatic patients. And then in addition to that, adults are separated from pediatrics and from yung sa mga newborn natin ng mga patients.
Yeah. Or yeah.
Because again, we understand naman that the risk categories of these age groups are different.
Okay. So, sir, how about the results po, Sir Glenn? So, what are the ways that you can give the results to your patients? May it be coming from the ER, inpatient, or outpatient?
Aside from the traditional way of obtaining the result, which is to go to the lab, get the result, we can email. We can email the results, provided you fill up a consent
Provide.
form. Yes, a consent form to email because again we're adherent to the data privacy uh, policy of the government. Lab and Go is also actually Med Lifestyle. Another way of getting your results is through Med Lifestyle where you can view it online. So currently meron tatlong means. Via email, the traditional way, and yung Med Lifestyle. So right now, we're actually encouraging our patients to have their results taken or for them to take the results online. Kasi again, we don't want them crowding in sa hospital. Kasi again, we're trying to institute yung 2 meters na social distancing.
Okay, all right. Thank you for that, sir. Last, sir. So this is a question from Mambea. So she's saying some are suspending their annual checkup due to the fear of contracting COVID-19 in the hospital. So what can you say about this, po, sir?
For that, again, the hospital has modified its services for them to be able to not miss their annual checkup because again the virus is real. Okay, and don't get me wrong, the virus is really there. However, if you practice yung ating mga social distancing and then yung mga minimum health protocols, then you should be fine. If you belong sa mga high risk groups, then I suggest that you avail of the home care. Yung medtech na lang or ang medical professional will be the one to go to your residence to have your blood tests done. And again, the lab and go is also another option, another viable option. So one fear is what if a medical practitioner natin ang carrier of the virus, which is again another possibility. So to allay anxieties and fears with regards to that, even the staff, even the medical staff need to answer the same questionnaire being answered by the patients, yung health declaration. So they have to answer if meron ba silang symptoms, feeling at the moment, do they have a recent travel history, or do they have close contact with a known positive individual of outside of the hospital. So yun. So again, if nakapasa naman dun sa questionnaire na yun, then we let them go on duty. Pero if the patient, if the staff is currently experiencing symptoms, kahit paubo lang yan, we're not taking any chances. We are actually asking the staff to take a medical leave or a sick leave for that matter, to observe um, if it is possibly COVID or what. So, ganun siya. So again, Davao Doctors is um, one of the top priorities of Davao Doctors Hospital is the safety of the patient. So if you need to have your laboratory tests done, have them done because again, there is a right modification of program or a service for you.
All right. Thank you, sir. So, Ma'am Zenaida Banzon, let me read first her comment po, sir, ha. So, Ma'am
Yes,
Jigs
yes.
is also telling everybody who is watching, to our viewers and to whoever is watching this video, that the Southern Philippines Medical Center is a designated COVID hospital, but because they cannot refuse patients, they also have designated areas or ward for non-COVID patients as well. So they are still catering patients with previous consultation, meaning these patients have talked to their doctors, maybe online, and they do the lab test or the lab request by their doctors or encoded by their physicians. So again, netizens, our Southern Philippines Medical Center also catered to dialysis patients, and they do surveillance for swabbing our patients as well. So yeah. So Sir Glenn, is Davao Doctors also a COVID hospital? Do you cater patients with COVID or no?
We used
You
to.
said
Yes, we used to cater to patients who suffer from COVID, but because of the recent proclamation by our mayor, na since low risk LGU na ulit si Davao Region and SPMC can now cater to all COVID positive patients, then we refer all COVID positive patients to SPMC.
okay. Thank you, sir. So, Ma'am Jigs is also saying, everybody, that the lab staff are given ample PPE or personal protective equipment and are tested with COVID, RT-PCR every month for surveillance. But if they experience signs and symptoms, they are referred to the personal health service and are managed accordingly. So, same but different protocols with the Davao Doctors Hospital. The Southern Philippines Medical Center is also catering non-COVID related cases for netizens. So you can go to the Davao Doctors Hospital and or to the Southern Philippines Medical Center to have your test or annual check-up done pa rin. So, still continuing pa rin ang mga laboratory services amidst COVID-19 pandemic. Okay. So, sir, can you give us a short and brief, simple message to our fellow medical technologists and to our viewers who are hesitant in doing their lab test because of COVID? What can you advice po to them?
Okay,
And also to
so
Ma'am G.
okay, sige. Okay, so for everybody listening right now, I urge you if you're feeling anything sa inyong sarili, do not hesitate to seek medical help immediately because ang common ang common reason why patients actually refuse to have themselves checked up is because baka daw i-declare na COVID naman. So again, if you're feeling anything, kahit pa simple sipon, cough or fever, you seek medical attention immediately because again, if you're not going to seek medical help or if you're going to do self-medication, mas malala, mali na antibiotics ang i-take mo, so whatever, then it can do more harm than actually refusing to have yourselves checked. Anyway, strict health protocols naman are in place to ensure everybody's safety. Again, if you can manage to go to the supermarket, if you can manage to go to coffee shops, to malls, why can you not go to the hospital, especially if you really need medical help, diba? So,
Yeah. Yes, very much. So we would like to reiterate to our viewers and to our audience for today's Edu Trends that there are still lab services offered by the two big hospitals in the city. Okay, all you have to do po is have your physician's request or doctor's request for your laboratory. You can go in their hospital so long as you fill up the health declaration form provided at the entrance of both hospitals, your QR code, and of course your lab request signed by your doctor or texted or messaged by your doctor. And then you can go in the lab and then have your blood work done over there. Rest assured that all their staffs are regularly also monitored with RT-PCR of the COVID-19, making you feel safe that everyone that you encounter in the hospital, especially in the laboratory, are COVID-free. And naman po, they are also vaccinated na. I think both of these hospitals, the health workers here have been vaccinated. Am I right, sir? I think, yeah.
yes, yes.
Yes. Okay. So, thank you so much, Sir Glenn, for sharing your information and the services that your hospital offers, and also to Ma'am Jigs Banzon for also sharing the services that the Southern Philippines Medical Center is offering for again in the midst of the pandemic po. So to formally end this Edu Trends, I would like to call in the Dean of the College of Health Sciences, Ma'am Maria Bealao, for her message to every one of us.
Okay, thank you, Ma'am Chelsea, and thank you to Sir Glenn, no, for that very informative presentation. So tonight's session is indeed helpful. I myself, madami akong na pick up no, ng mga information, especially to the available laboratory services that we have. And we are thankful that our speakers have graced us the time. Kahit na may difficulties si Ma'am Jigs, but she was able to share her insights. And time for the information dissemination, like the available laboratory service. I think I appreciated the most that because of the new normal, no, we also have adapted to the technology based na ano ba yan, services that we can offer to the general public. So this is true for both the government and the private hospitals, and we are very thankful for your we are very thankful that you are able to share this with us. And through the EduTrends, we are able to share this to the general public as well. We are hoping that we have become a vessel to you, especially to your respective hospitals, as we will be able to share that despite amidst the pandemic, despite the challenges that we have, laboratory services are still available. So from the College of Health Science, the Medical Technology Program, and in behalf of the entire Academic Council of Jose Maria College, and in behalf of Pastor Apollo Sico Buloy, thank you very much for raising us your time. Thank you to our speakers, Sir Glenn Castro and Ma'am Zenaida Banzon, for your time with us tonight. Again, we are very thankful for your time and sharing your services, no available services with us. Also, to our viewers, thank you for your time, and we hope that through this we are able to enlighten you na kahit na pandemic, still health is a priority. Still, we can go to the hospital or to the laboratory for checkup. We just have to follow the protocols. So I hope that this session is really fruitful for everyone. And God bless everyone. Keep safe and keep healthy.
Thank you so much, Dean Bea. All right. So to our dear netizens, J. Marians, to our viewers, and to everyone who is watching and will be watching this EduTrends, we would like to reiterate the facts again and again that in Davao City, especially in Davao Doctors Hospital and in Southern Philippines Medical Center, we still cater non-COVID related laboratory services as long as you have your doctor's physician with you. You fill up the health declaration form, and then you have your QR code. You can go to the lab, you can go to the hospital, and then have your routine blood work done. Also, our hospitals in the city have online consultations. Medical technologists can go to your houses at Davao Doctors Hospital. They have their service like that. And even you can drive through in their hospital. There is a certain area there where you can have your blood extracted. So we are urging everyone to still have their screening and monitoring laboratory tests done without hesitation because it's not stopping the pandemic. All right. So thank you very much for being with us in this EduTrends. See you in our next episode.
That ends another substantive discussion on JMC EduTrends, produced by the Jose Maria College Communication Affairs Office. On behalf of our founding president, Pastor Apollo C. Kibuloy, thank you for being with us. Join us again next time for another interesting, inspiring, and transcending discussion on JMC EduTrends. Bye everyone, and keep safe.